talked a little bit about this. This was a topic that sort of interested me. Doing a literature review specifically, I felt to be a slightly less arduous option than gathering my own data. I was keen to avoid that if I could. I felt that would have increased the workload even further. I don't think it's something that should put you off if you were keen to gather your own data, but for me, I felt a literature review was a more manageable way to go about it with a contemporary issue. It had been quite topical in recent months and years in both of our college journals, and with a local research team working on it as well, I felt there was a bit of sort of momentum there. And importantly, there was a good number of articles to review in the systematic review without being too massive that it was just going to get way out of control. As you can see, my original idea of omega-3 supplementation in mood disorder just ended up sort of blowing up enormously within my first sort of literature search, and I felt that was going to be a little bit too difficult to contain. So you might find when you're doing your early investigation, you think, oh well, this is not so appropriate. Maybe I need to reconsider something more manageable. And when I mentioned thinking, how is your project potentially going to help you with other assessments or other areas of your practice, I kind of didn't think about this too much early on, but as I started going through, I identified, well, hang on, there's probably a number of important themes here that might be helpful, particularly, say, for a critical essay or a modified essay question, whatever it may be. And you can see they're listed there. We're constantly hearing debates about the utility of classification systems in psychiatry, the validity of diagnosis in general, but certainly a particular diagnosis. And are we just simply pathologising the experience of fit, active, healthy people that do have an outwardly healthy image? Part of my treatment implications at the end of the project, because that's a key area that you need to justify within your project, is how is this going to contribute to the field of psychiatry and to our knowledge? We talked about trying to identify a neurobiological correlate with muscularity-oriented body image disturbance. It's a bit of a mouthful. And potentially drug targets for those sort of things, keeping in mind that the monoamine hypothesis has gone somewhat stale, and in the future may be alternative targets for pharmacological therapies. The role of our society and culture, always keeping socio-cultural perspectives in all of these sort of things, whether it's in an exam or practice, is important. And from a sort of leadership and management perspective, which is, again, a big focus, particularly in the 2012 program, thinking about service development, do our eating disorder services potentially need to cater for, so to speak, and respond to these sort of difficulties? And I was working in an eating disorders unit at the time that I did this project, so that was, again, another good way to really sort of immerse myself in this content and be thinking in that realm consistently. I think that's a really helpful way to do it, is, again, keeping your momentum, keep the ball rolling on this. I think if I had have started, done a couple of months, left it, the time I'd left it would have just grown exponentially longer, and before you know it, it's 12 months down the track and you've really not progressed with it, and timelines are looming. So whatever way you can find to keep your momentum rolling is going to be really helpful for you. But again, to come back to the difficulty of containing it and how are you going to stick to the word limit, this, I don't mean to tell you how to sort of suck eggs, but developing a skeleton, almost like you would do a plan for an essay as an example, I think is a practical thing to do. I'm going to do 800 words on methodology, 200 on my sort of background and aims, 2,000 on my discussion, whatever it may be. Again, setting out sort of the college marking criteria, which was a bit of a theme from Neil's talk as well, constantly kind of thinking, am I satisfying all these areas, all of these requirements, and printing that out, having it beside you the whole time to make sure you're not sort of missing the mark on that one. Sticking to your perimeters, I think, is helpful as well, really important, because you are working with a relatively small word limit, and it just is so easy for it to encroach. If you add a couple of hundred words here and there, before you know it, you're having to cull elsewhere. We've sort of talked about the last point as well. So I think this is another really, really difficult question, when to do the project. Anyone else started a project? Anyone? Kim? Yeah. Is anyone willing to share their topics? I know we've got a couple of people at Geelong doing audits of things like adherence to lithium monitoring in outpatients, time to clozapine in treatment-resistant schizophrenia, so some audit, quality control sort of things. But yeah.
So I'm doing a joint project with another registrar,
Yep.
and one of us is doing a literature review of to come up with the guidelines for sexual health screening on the inpatient unit.
Yep.
And the other one is doing an audit of what happens in our inpatient unit and if it's, you know, anywhere close to the guidelines and how we can improve and all that stuff.
Yeah, sure. Okay.
Anyone else to share topics? Any thoughts?
And I think they're obviously vastly different to the topic that I chose, and that just gives you an indication that there's effectively endless possibilities with this, really. So it's, if you can't think of anything, you need to be maybe thinking harder, because there's a myriad of possibilities. And anecdotally, I know a lot of clinical directors have a metaphorical top drawer full of audits and quality control projects that they would be more than happy for people to undertake. Yep.
Sorry, sir.
The scholarly project, the topic, is there any merits in that aligning with your advanced training goals or interests?
Well, look, I think from my understanding, a number of the certificates of advanced training have an additional scholarly project requirement within that subspecialty as well. But that's not to say you couldn't still do your general scholarly project in an area that was applicable to something in your advanced training.
I just had
is that
this,
what you mean?
I had this question because I'm just nearing the first year of my training, and I had this discussion with an advanced training in my own service, and that's what he suggested, to just wait it out and so that you can align it with your advanced training requirements. Is it possible, or does it have to be a separate?
Well, you certainly can. I think this might possibly partly answer your question, but my understanding is everyone, regardless of whether they do a certificate of advanced training, needs to do, this scholarly project. If you do a certificate of advanced training, you'll then have to do another one within that certificate. Does anyone else have a better understanding of that? No, that was how I've interpreted it. So I don't imagine you could do the old sort of 2-for-1 kind of deal. Yeah.
So I'm in the certificate of old age psychiatry.
Great, yes. You can enlighten us, please.
Yep. And so you can submit the same project separately, but the criteria are slightly different. So it's possible that you'll pass one and not the other.
Yeah. Okay. Well, that's good to know. Yeah. Thanks for the clarification. So that answers your question probably better than I did. So that's really helpful. Is the standard in the advanced training certificate, I imagine, might be even above that of the general project? Do you have any insights on that?
Probably too early to tell, I think. But
yeah,
it's not clear. If anything, it's probably easier to pass the advanced training project.
Right. Okay. I think that demonstrates the enigma that is the scholarly project at the moment. Really, it's still relatively new, and neither I think us as a collective group of trainees nor the college are entirely sure about some of the finer details around those sort of things. So for the moment, it's a bit of a case of see one, do one, and hope for the best, I think. So our local director of training recommends doing it as early as possible. That's his philosophy. I think that's one side to the coin, and anecdotally, I think we're seeing a mixture of people doing that fairly early, and the other extreme, people doing it in advanced training years, and not necessarily a whole lot of people in between at this time. And look, there's clear pros and cons to each one, regardless of how you do it. There's not necessarily a right or wrong answer. It probably depends, again, partly on how you're going to factor in everything else that you need to do, particularly with regard to major assessments. And this is the other big mystery, I think, across the 2012 program in general, the junior consultant standards. It's become a bit more clear with some elements of the program, but with regard to the scholarly project, what's the difference between an advanced trainee and a junior consultant standard when it comes to research? We don't really know, I don't think. But the simplest way to think about the project, not only with the junior consultant aspect, but just the project in general, is can you produce something that would be of sufficient quality, original, your own work, to be published in a reputable peer-reviewed journal? And I think that's the, if we had to reduce it all down to one thing, that would kind of be the question. Something like Australasian Psychiatry does publish scholarly projects and has sort of openly said, that scholarly projects will provide us with lots of great materials. So reading through some of the reviews and the debates and the editorials in our college journals, I think is a really good start for a framework if you're not too sure how to go about these sort of things. So some of the really important points. Think about when you plan to do the project. It's really important. Like it's just so easy. I know I'm banging on about this repeatedly, but it's so easy to put it on the back burner and think, oh, well, I'll do this first and then this and then that or whatever. And before you know it, the project is popping up and you're feeling a bit sort of stressed about that. So think, the earlier you can think about when am I going to apply, when am I going to do it, how long is it going to take, where am I going to allocate that time in, and choose an area that you have a genuine interest in. And preferably something you're particularly passionate about or something that might lead to advanced training or sort of subspecialty interest, whatever it may be. But you do, I think, to give you a chance, give yourself the best chance of success and enjoyment from this, it's got to be something that you're particularly passionate about. Do your proposal, get your ethics approval as soon as you can. Don't delay the process. Again, just keep it happening. And work closely with your supervisors. My first draft came back pretty much the entire thing just covered in red pen, so don't personalise it. It's meant to be that way, I think, and that's what we need to do to get these things up to standard is have honest but helpful feedback. It's they're not direct criticisms, but you do need a supervisor that's comfortable to give you constructive feedback rather than say, yeah, look, this is great, when in reality it's pretty average. So I sort of had to rewrite my whole thing effectively after the first draft. So be prepared for those sort of things, particularly if you're a research novice such as I was and probably still am, but that's all part of the learning process. Just as important, again, like all of these assessments, print out the marking criteria, literally keep it there beside your pile of journals, constantly be going back and forth. Am I satisfying this? Can I tick this off? Yes, no, okay, what do I need to do to get this section up to par? And probably I think the last point, again, I've said it enough times now, but this is like ripping off a Band-Aid doing the project. You've just got to get in, do it, get it started. It's not going to go away, unfortunately, if you leave it. And if you don't want to be a registrar forever, this is one thing that you're going to have to just get on and get done, really. So that's my sort of quick cook's tour of the scholarly project. So are people wanting to ask any particular questions or criticisms?
I think there are some important lessons through, I think, the entire day, I think, and you sort of bring it back together, because the most important thing is starting early. Whether you're looking at a psychotherapy case, whether you're looking at formulation management, whether you're looking at, management of metabolic syndrome, physical examination, whatever it is, the most important thing is sitting with it constantly as you're practicing. It only takes a minute or two of reflection after you've seen a patient to actually imbibe a lot of these things. Could this be a question for the scholarly project? Am I able to do a quick examination, for example? What would be the formulation? By doing this day in, day out, believe me, you end up sort of learning without really knowing that you're learning. It's effortless. So I think it is very important, the preparation phase. It's like learning a new language. You don't necessarily start a new language when you say, oh, well, you know what, I'm going to go to the country and I'll automatically learn it. So most people often go, before the MEQ, they start preparation 2 months, 3 months before. It's not an exam that you can pass with 3 months. Well, sometimes you can, but there's much more to it. The same thing here with scholarly project. You are going to learn skills that are very, very different, and they will without a doubt be useful for you in the future. Simple skills like, as you said, just taking criticism. Put in a paper for publication and you get way worse feedback, because it's peers criticizing you. And the things that they write, sometimes you go, you're going 3 rejections and then you send it back. Some publications take a year and a half to get in. Personal experience of 2 or 3, and you go, well, spend a year and a half to read this crap. But, it's just something you've got to go through. But it's satisfying at the end of the day when you do publish. So I think well done for bringing this out and obviously going through this in a very systematic and structured manner.
Thank you.
Any questions? Well, but any questions for Doug? Because we do have time. Yep. I'll just bring this.
You may have already answered this already, but I just wanted to get a bit more detail.
Sure.
You did mention that the psychiatry implications of your project.
Yep.
And I'm not sure of the criteria. You have to put something in along the lines of psychiatry implications, but it's I'm just not sure what's sort of mandatory. So if you did an audit, for example, do you have to go back and then review the changes from that audit, for example?
Well, I would
put
think
that
in something
report?
like an audit, you might be able to use that to identify gaps in what your service is doing or not doing. As an example, you might say, all right, we achieved 10% compliance with metabolic monitoring for people on antipsychotics. You could then take that to your executive team and say, look, I've identified this. I think we really need to start promoting the importance or having some sort of quality control procedure around this. Yeah. So the implication would be service delivery and sort of ensuring those things are done. Is that what you mean?
Yeah, and I was just wondering in sort of the level that's kind of considered junior consultant for, say, something like that. Yeah. Like what would
Join
be...
the club.
Yeah, okay. Yeah. Fair enough.
Look, I think it's you would need to demonstrate a sufficient depth of discussion and consideration of broader contextual issues above and beyond, okay, well, let's use the example again of metabolic monitoring. It's not happening, we need to do it, end of story. That would maybe be a registrar sort of level, but the deeper reflection might be, okay, well, let's think about why as a service this is not happening. Is there, do people feel it's futile or not our job, or what is it about these findings? What does that represent on a sort of deeper level?
Yeah. Cheers, thanks.
This might sound a bit silly, but it's quite sometimes practical to discuss about funding. Does the college have any, does it support towards like a funding model for this scholarly project?
To undertake the scholarly project? I think the closest thing would probably be, the rural education grants and those types of things, if they applied to you, but I'm not aware of any research funding as such like you would get from, say, the government. If you applied for research funding, it's just sort of a case of, do it in your own time, and this is just part of what you need to do.
So it'll be more prudent to just choose something that doesn't involve a great deal of cost.
I would encourage that, unless you're particularly passionate and we're happy to cough up the money yourself. But you may be able to apply for research funding to undertake your project, or your research with a view to also using it as your scholarly project requirements. But the college, I don't believe, directly has any arrangement of that nature.
And the other question I had is, does the topic should it be clinically oriented, or it can be something to do with an administration, like a funding?
Oh yeah, it can take any form really, as long as it's got relevance to psychiatry.
Yeah. Okay. Thank you.
Yeah.
All right. Well, thank you very much, Doug, for that excellent presentation.
No problem.